Hey guys, let's have a quick look at asthma using our Patho on the Go pocketbook. So asthma is a common chronic inflammatory disorder of the airways, and it can be caused by genetics. You can also have exercise-induced asthma, and it could be triggered by allergens such as pollen, dust, and it may also be caused by smoke or perfume. So signs and symptoms include cough, which can be worse at night, shortness of breath, chest tightness, they may have an expiratory wheeze, tachypnea, and they may be using their accessory muscles. So asthma is triggered by exposure to allergens, irritants, or respiratory infections. Now, in response to these triggers, the airway walls become swollen and produce excess mucus, while the smooth muscles around the airways contract, causing them to narrow. This leads to the difficulty in breathing, wheezing, and coughing. So we manage asthmatics with beta receptor agonists such as salbutamol, inhaled corticosteroids such as beclomethasone, and long-acting beta agonists such as salmeterol. Now, if they're having an acute asthma attack, we manage them differently, and we manage them with the really handy mnemonic. So O stands for oxygen, and we give oxygen if the patient's saturations are less than 92%. S is for salbutamol, and we give this via nebulizer, and we can give this air-driven or oxygen-driven, depending on the oxygen needs of the patient. H stands for hydrocortisone IV. I is for ipratropium nebulizer. Again, we can do it air-driven or oxygen-driven. T stands for offerin, such as aminophylline, and that would be IV. M is for magnesium sulfate, again IV, and E is escalate to ITU. Some asthmatic patients will need to be intubated and ventilated. Hope that helps.